Hello and welcome to our show, Health and Wellness, Myths versus Facts. I'm Gargi Rawat. Physical health and wellness are more important than ever, despite the fact that health and wellness were already important previous to the health crisis. The spread of COVID has pushed them to the top of the priority list. The pandemic not only brought attention to the country's urgent need for improved public health infrastructure, but also demonstrated how the incidence of lifestyle diseases is becoming a significant source of concern. Declining physical activity, sleep disruptions, inadequate nutrition, and increased substance use all have repercussions on emotional and physical well-being, especially in a young population. Awareness about such lifestyle disorders is important in a young population, and once you're aware of the risk factors, then you can take the right steps to reduce their impact. We have with us a panel of experts to guide our youngsters about the management of lifestyle disorders. We're joined by Dr. Utkal Kishore Khadanga, consultant diabetologist and physician, Care Hospital, Utkal Diabetes Care, Bhubaneswar. Thank you so much, doctor, for joining us on the program. And first and foremost, I'd like to ask you about what is maturity onset diabetes of the young? When do you suspect MODY diabetes?
So this is a form of diabetes which occurs in the young adults, otherwise known as MODY, that is maturity onset diabetes of the young or monogenic diabetes. Its prevalence is 70 to 110 people in 1 million, that is almost 1 to 2%. There's a 50% false degree that relatives will inherit the same mutation, and we can diagnose it when the age of onset is usually less than 25, and usually they are non-obese persons, and diabetes runs in the families with 3 consecutive generations of inheritance, and diabetes may be treated well with diet and exercise alone, and they may not need insulin, and they do not have insulin resistance syndrome, and the most important, there is absence of ketosis at any point of the life. So, as I said, but the thing is that this disease can never be prevented, as it has got an autosomal dominant pattern of inheritance, and there is change in a single gene which is passed by an affected parents to their children. So all children with an affected parent will, with MODY, have a 50% chance of inheriting the affected gene and develop in the latter part of the life within 25. And almost 11 varieties of MODY that we have got till now. And the most common form of MODY is MODY3, which has got a mutation in the hepatic nuclear factor 4 alpha. And this pattern of MODY needs mild sulfonylureas for treatment of diabetes, that is insulin secretagogue. They do not require any insulin or insulin sensitizer for treatment. And the mildest form is the MODY2, otherwise known as glucokinase diabetes, and they may not require in treatment after all, and they may do well with diet and exercise. Thank you.
All right, doctor. Now, are there different treatment protocols for managing diabetes in young adults compared to the elderly people? Already we know that this is what all of you doctors call a ticking time bomb in the country, and more people are getting detected with diabetes at younger and younger ages.
Yes. When you talk about diabetes in the young adult, there are garden varieties of diabetes actually, like type 1 diabetes, type 2 diabetes, I just said maturity onset diabetes of the young, then comes the fibrocalculous pancreatic diabetes, that is FCPD, and the secondary form of diabetes. So all these different forms of diabetes, diagnosis is most important. So to diagnose it properly, to treat it accordingly. Like type 1 diabetes, they require insulin for the survival throughout the life. Type 2 diabetes, they do very well with the OHA, that is oral hypoglycemic agents or tablets in the initial part, 10-20 years, and they may require insulin in the latter part. The MODY, as I said, they need milder sulfonylurea, that is insulin secretagogue for treatment, and they do not require any insulin sensitizers like metformin or pioglitazone, and they may not need insulin also. And again, this MODY has got 11 different forms, and for different forms, different treatment is required. Then comes the FCPD, that is fibrocalculous pancreatic diabetes, and in this form, they have stones in the body or the tail of pancreas, and for the treatment, they require insulin, or maybe they respond to small bit of sulfonylureas. And then comes the secondary forms of diabetes, like the drug-induced diabetes or steroid-induced diabetes. They have got a different treatment protocol. And the post-pancreatectomy, like post-pancreatic surgery diabetes, they need insulin for the treatment. So all these different types of diabetes have got different treatment protocol, and if you don't diagnose it properly, we cannot cure it. So that is important. The treatment is tailor-made.
All right, and are young adults with diabetes more prone to heart attacks? What are the early signs that they should now look out for?
Yes, as you rightly said, they are more prone for heart attack. And to be precise, these young adults have got 15 times more chance of getting a MI or myocardial infarction than those who are getting diabetes in the latter part. And the signs we should look out for are like obesity, shortness of breath, chest discomfort, anxiety, irritability, and easy fatigability. And I must say the reason why they land up into this, the early heart problems is due to the change in lifestyle, unhealthy food habits, smoking, increased stress, target-based job, then lack of exercise, sedentary pattern of life. So all this they put they're more prone to get diagnosed with diabetes and increased heart risk. So I may add a little bit to this. If the patient, they may feel this shortness of breath or chest discomfort, then they should visit a doctor or physician immediately for a complete checkup and thereby to diagnose what is the cause. And nobody should ignore the initial signs like shortness of breath or chest discomfort and maybe gas. They should not do that. And in the recent times, the death of the fitness icons like Mr. Puneet Rajkumar, Mr. Siddharth Shukla, and Mr. Kaizad. So this will not send a wrong message to the society that exercise causes these fatal heart diseases. No, the right kind of nutrition or the moderate good nutrition and moderate exercise, proper sleep actually helps in keeping the disease away, and that's the norm.
All right, we're also joined by Dr. Roshan Bhandari, a consultant physician and intensivist, Shri Tulsi Critical Clinic, Nandurbar. Thank you so much, doctor, for joining us. And my question to you is, type 2 diabetes is usually more commonly seen in middle-aged or older adults. Can you get type 2 diabetes if you're in your 20s? And what are the risk factors and warning signs that young people need to look out for?
Yeah, the type 2 diabetes is very common now, and it is increasing in the young group of peoples because of the altered lifestyle and eating habits. Our main risk factors are responsible for the developing of the type 2 diabetes. Also, the family history of diabetes and obesity, these are also the two risk factors. During this pandemic and COVID, those youngsters who have recovered from the COVID, they are also prone to develop the diabetes. During the lockdown period, all the health, lifestyle, our eating habits, and everything has been disturbed. So our incidence is very early, and so complication also gets so early. So mortality is high in such group of patients. So managing is very challenging such patients. So early screening is very important. At least once a year we should screen and to avoid the accidental diagnosis of the diabetes.
All right, so early screening is important to avoid this accidental diagnosis of diabetes, but it's really an opportunity also to take control of health before full-blown diabetes. So, doctor, what steps should a person take if he or she is detected with pre-diabetes at an early stage? Can you then prevent full-blown diabetes?
Yeah, pre-diabetes is also the means a condition where the sugars are on higher side, but it is not qualified to tell that a patient is a diabetic. So once the patient get diagnosis of the pre-diabetes, he should alert and he should take care of the lifestyle changes and dietary habits changes. So avoid the junk food, fast food, and fried foods, and smoking also. I would prefer mainly the vegetables and fruits and whole grain food. They should avoid the high glycemic index containing the foods. So they should also reduce their body weight by doing the regular exercises because at least 5 to 10% risk goes down if you do exercises. So thereby we can decrease the incidence of the diabetes, or we can prolong the diabetes. Also, you should target your exercises at least 150 minutes for a week, or 5 days in a week. For 30 minutes daily exercise should be done. And most important is the stress management, because stress, everybody has a stress in the family. So parents, I will humble request to all the parents and the children that they should take, they should all stop these gadgets, electronic gadgets during their breakfast and also the lunch time, dinner time, and share their knowledge and their feelings so that we can, they should indulge in their hobbies. Parents should also indulge. That's why we can manage this our diabetes.
All right, that's why we call it a lifestyle disease as well. And you're saying parents should also lead by example and not be stuck to their gadgets during meals and push their children, for more hobbies. We were discussing with Dr. Utkal about young people and diabetes and management. So, Dr. Roshan, when younger people are detected with type 2 diabetes, do they have more severe symptoms or do they develop complications sooner?
As the young people, when they get diagnosed with the diabetes, they get very panic and the stress, because of type 2 diabetes can occur in any age, including the children. So especially those who are obesity and overweight, so they are the more risk factors for developing the diabetes. So complications like microvascular and macrovascular, both type of complication they can get. Like if this disease is getting early, the complications are also going to get early. As we know, they can get the heart disease, kidney disease, and neuropathy changes, then pains in the legs, and some skin diseases or some psychological problems. So early detection, aggressive management of the risk factors are warranted. Also, we are looking now for smoking, tobacco, and e-cigarettes are very oftenly used by all the adolescents. So we should keep on mind that they should be stopped, and aggressive management should be warranted.
We'll slip into a short break now and return with more questions regarding diabetes and managing our health. Welcome back. You're watching Health and Wellness, Myths versus Facts. We're talking about health, diabetes and the younger population. Dr. Utkal Kishore, crash diets can be tempting to follow if you're wanting to lose weight. Many young adults do such diets to get a zero figure. But is it unhealthy to lose weight fast, and can it have a lasting effect on your health?
Yeah, of course. Any sort of crash diet is not a good for health, and it leads to metabolic imbalance. And there is a loss, not only loss of fat mass, also loss of muscle also. So crash diet reduces the metabolic rate of the human being and weakens the immune system, causes dehydration, disturbance in the bowel movements, and causes low energy levels. And there are various types of crash diet like keto diet and low carb, high fat diet, low fat, high carb diet, very low calorie diet. So all these different fat diets have got different complications. Like keto diet may cause ketosis. Low fat diet and high carb diet can lead to dyslipidemia, and low carb, high fat diet may cause like cholelithiasis and bowel imbalances, and even the very low calorie diet may cause irritability. So these are the things, it's very actually fashionable nowadays for these fat diets to lose immediate body weight. But it happens that as soon as you stop these fat diets, you tend to rebound, weight gain is always seen. And the goal should be like, slow, steady. You should take small goals, like 10% of the weight loss in coming 6 months. And we can actually achieve that. Then again, further look for a 10% of the weight loss.
All right, Dr. Roshan, due to the lockdown, and I know you spoke about this a little earlier as well, but if you could elaborate further, due to the lockdown, the screen time for children increased with restrictions on going out. Children are now getting mood swings even. Can depression and anxiety cause further lifestyle diseases in children?
Yeah, very rightly said that during this pandemic, the screen time has gone up for these children, and but we cannot avoid it. The school is going on the screen. The college is going on screen. And that has caused, number one, they have this sedentary lifestyle. They have to look at the screen for 8 hours, 10 hours a day. And they do not get the facility to go and play outside. There is no physical activity. And in fact, sitting in front of the screen, that strains the eyes also. They're having eye problems. And that causes the irritability, the mental imbalance. So all these are there. But these are the part and parcel of this COVID. We just can't help it, right? But what we can do that, apart from the school time and the coaching time, we should avoid the children. They should avoid the use of these mobile phones or the video games or the TV watching time. We should indulge them in the other activities like maybe small sports games like Ludo, chess, or carom, and conversation making, small talk. That is better than watching a movie together.
All right, Dr. Roshan, anything you'd like to add to that? And also on the subject of children, is it the correct way to think that some children are overweight because they have big bone structures? And what is the right way to measure obesity in children?
So big bones and large bones are not the correct way to measure childhood obesity. WHO had recommended the BMI, body mass index, is the correct way to measure the obesity. BMI is between the 25 to 30, we call it overweight, and if it is more than 30, it is obese. So childhood obesity is very now common, and it is the major risk factor for the developing the metabolic diseases and sleep apnea, psychiatric illness, hypothyroidism, and also the diabetes. So this can be prevented by the changing our lifestyle, eating the healthy habits, and regular exercises.
All right. Now, Doctor, if you can talk about the younger population, getting diabetes earlier, and Dr. Utkal, if you could tell us, whether this means that there should be early screening for diabetes. Is that now necessary? And what age should people start screening for diabetes? What other tests should they do?
Yeah, this is a very good question you have put. The early screening is necessary, and we should know for whom we should screen. So I must say that almost 50% of the pediatric patient age group has got diabetes, and they're mostly type 2 diabetes. And the age for initiating the screening is 10 years at onset, or if puberty comes earlier. So if puberty is earlier, then you have to check it at that time, and then check it once in 2 years. Okay. What is the criteria to check? When do we check it? So at risk of an overweight patient, like body mass index more than 85th percentile for age and sex, or weight for age or sex and height more than 85th percentile, or the overall body weight more than 120% of ideal weight for height, plus any three of these signs, like number one, family history of type 2 diabetes in first or secondary relative. Number two, race or ethnicity, like Native Americans, African Americans, Hispanic Americans, Asian Americans, Pacific Islanders. Number three, the signs of like insulin resistance, like acanthosis nigricans, or other comorbid factors like hypertension, dyslipidemia, polycystic ovary syndrome. If any two out of these three are there, then we should go for checking. All right. How do we check? The gold standard to check or the test is the oral glucose tolerance test. That is, we need to check the fasting blood glucose and give a glucose load with 200 milliliters of water and check a 2 hour postprandial blood glucose. For this age group of less than 3, we must take a 2 gram of glucose per kg body weight and add 200 ml of water. For the age group of 3 to 10, we have to take a 1.75 gram of glucose per kilogram body weight and add 200 ml of water and check. And for above 10 years, it is 75 gram of glucose. Even for the adults, it is the same thing. Okay, then what do? We check a fasting and 2 hour postprandial glucose. And if at all the fasting blood glucose is more than equal to 126, or the 2 hour post glucose load is more than 200, we put a diagnosis of type 2 diabetes. Or no, not type 2 diabetes, diabetes. Thank you.
All right. Finally, Dr. Roshan, is there something you'd like to add to that? And also this issue of younger and younger people getting diabetes. We were talking about how it's this ticking time bomb, and it's all to do with the lifestyle. So that is something that one has to change to ensure the younger population don't get diabetes, isn't it?
Yeah. Actually, we should promote all and make awareness to all the adolescents and the teenagers regarding the health related problems and how to since morning when they get up, they should do regular exercises. They should avoid all the addictions and eat healthy food, avoid the junk food, fried foods, and stress-free. There should be no tension when during the a lot of competition is there in the every field, so they should avoid and keep them healthy.
All right. Well, thank you so much, doctors, for joining us on the program and answering all those questions about maintaining health and the dangers of getting diabetes early and what you can do to prevent that. Thank you so much for joining us. Thank you all for watching at home. Goodbye.